Welcome to part 4 of our series, Top 15 Common Injections You Should Know. In this video, we'll explain the generic names, doses, mechanisms, and uses of these injections simply. In this video, we'll explore 15 more injections commonly used in hospitals and clinics. You'll learn their purpose, dose, and mechanism in a simplified way. First, enoxaparin, also known as Clexane. The dose is 40 milligrams subcutaneously, once daily. It enhances antithrombin activity to prevent clot formation and is used for DVT prevention and post-surgery care. Remember to inject subcutaneously in the abdomen and not rub the area. Next is heparin injection. The dose is 5,000 units subcutaneously every 8 to 12 hours. It inactivates clotting factors, providing an anticoagulant effect. It's used for DVT, pulmonary embolism, and heart surgery. Monitor APTT as there's a high risk of bleeding. Magnesium sulfate injection has a dose of 1 gram IM or a 4 to 6 gram IV loading dose for preeclampsia. It acts as a CNS depressant, anticonvulsant, and muscle relaxant, used for eclampsia, preterm labor, and severe asthma. Monitor reflexes and respiration. Diazepam injection, or Compose, is given at 5 to 10 milligrams IV slowly. It enhances GABA activity, providing sedative and anticonvulsant effects. Uses include seizures, anxiety, and status epilepticus. Inject slowly to avoid respiratory depression. Midazolam injection, also known as Midazolam, is typically dosed at 2 to 5 milligrams IV before procedures. This short-acting benzodiazepine induces sedation and is used for pre-anesthetic, conscious sedation, and seizure control. Monitor oxygen saturation due to the risk of apnea. Ketorolac, or Ketanov injection, has a dose of 30 milligrams IM every 6 hours as needed. It's a potent NSAID that inhibits prostaglandin synthesis, primarily used for short-term postoperative pain relief. Avoid in renal impairment and do not use for more than 5 days. Paracetamol injection, or Perfalgan, is dosed at 1 gram IV every 6 hours with a maximum of 4 grams per day. It inhibits central prostaglandin synthesis and is used for fever and mild to moderate pain when oral administration is not possible. Administer as a slow 15-minute infusion. Tranexamic acid, known as Trenexa or PAWS, is administered at 500 to 1,000 milligrams IVIM every 8 hours. It inhibits fibrinolysis to prevent bleeding and is used for heavy bleeding from menstruation, surgery, or trauma. Do not mix with blood products or penicillin. Methylprednisolone, or Solumedrol, has a dose of 40 to 125 milligrams IV once daily. This corticosteroid reduces inflammation and immune response, treating severe asthma, allergic reactions, and autoimmune disorders. Avoid sudden discontinuation after long-term use. Dopamine injection is given as a 2 to 10 micrograms per kilogram per minute IV infusion. It stimulates dopaminergic and beta receptors, increasing cardiac output, and is used for shock and low blood pressure. Continuous cardiac monitoring is required. Dobutamine injection is administered as a 2 to 20 micrograms per kilogram per minute IV infusion. This beta-1 agonist improves heart contractility and is used for acute heart failure and cardiac shock. It must be administered via an infusion pump. Phenytoin injection, or Eptoin, has a dose of 15 to 20 milligrams per kilogram IV as a slow-loading dose. It stabilizes neuronal membranes, acting as an anticonvulsant for status epilepticus and seizures. Administer slowly to prevent hypotension and arrhythmia. Mannitol injection, known as Osmetrol, is given at 0.25 to 1 gram per kilogram IV over 30 to 60 minutes. This osmotic diuretic draws water out of brain tissue, used for brain edema and raised intracranial pressure. Inspect for crystals before use, as warming may be needed. Lignocaine, or lidocaine injection, is used as a 1 to 2% solution locally or intravenously as an antiarrhythmic. It blocks sodium channels to prevent nerve conduction, providing local anesthesia or treating ventricular arrhythmias. Avoid accidental IV injection during local use. Finally, dexamethasone injection, dosed at 4 to 8 milligrams IVIM once daily. This potent, long-acting corticosteroid is used for cerebral edema, severe inflammation, and COVID-19, and often prevents nausea in chemotherapy. In summary, anticoagulants, sedatives, steroids, and painkillers are vital in hospital care. Always check the route, dose, and dilution before giving any injection. Rational use ensures patient safety and effectiveness. Thank you for watching PharmaXene. Like, share, and subscribe for more medical content. Our next video will be part 5 of the Common Injection series.